Let's walk through the heart and uncover what happens in mitral stenosis. In a healthy heart, blood returns from the lungs, full of oxygen, into the left atrium. From there, it flows freely through the mitral valve into the left ventricle, which then pumps it out to the aorta and into the body. But in mitral stenosis, the mitral valve is narrowed. This restricted opening makes it harder for blood to move from the left atrium to the left ventricle during diastole. So the left atrium has no choice but to push harder, and over time it starts to stretch and enlarge or dilate due to the pressure overload. As the left atrium enlarges, it starts to crowd nearby structures in the chest. It can compress the esophagus, causing what's called dysphagia, or difficulty swallowing. It can press on the left recurrent laryngeal nerve that loops around near the heart, causing hoarseness of voice, also known as dysphonia. It may even push against the bronchi, leading to a chronic cough. This enlargement disrupts the heart's electrical signals, causing the atrium to quiver. This is atrial fibrillation, a chaotic rhythm that causes the atrium to stop contracting effectively. Because it's no longer contracting effectively, blood pools. This is a condition called blood stasis. Blood typically pools in the left atrium. From here, the clot or thrombus can travel. If it dislodges, it becomes an embolus. It can shoot into the brain and cause an embolic stroke. This is when it becomes a life-threatening complication. As the blood struggles to pass through the narrowed mitral valve, pressure backs up into the pulmonary veins, then back to the lungs. The lungs begin to fill with fluid, a condition called pulmonary edema. This brings dyspnea or shortness of breath, especially during activity. The patient also gets orthopnea. This is when the patient lies flat, fluid spreads more evenly through the lungs, worsening the shortness of breath. And when fluid pools overnight and wakes a person up gasping for air, that's called paroxysmal nocturnal dyspnea, or PND. As the pressure in the lungs continues to rise, we reach pulmonary hypertension, a condition where the arteries in the lungs become narrowed and stiff. This adds strain to the right side of the heart, which now has to work harder to push blood from the atrium to the tricuspid valve, through the pulmonic artery, and into the lungs. Over time, the right heart begins to fail, leading to right-sided heart failure. And when we get right-side heart failure, the blood backs up to the superior vena cava back to the jugular veins, causing jugular vein distension. The blood also backs up to the inferior vena cava, causing hepatic congestion, ascites, and further down causing ankle or lower limb edema. Meanwhile, less blood is making it through to the left ventricle, and ultimately, less oxygen-rich blood is reaching the body. This leads to fatigue, cold extremities, and exercise intolerance. When the demand for oxygen rises like during a workout or even walking upstairs, the heart can't keep up. That's when SAD kicks in, syncope or fainting due to lack of blood to the brain, angina or chest pain from inadequate oxygen to the heart muscle, dyspnea, which again is breathlessness, from both lung congestion and low cardiac output,